Hi everyone, thank you so much for joining us for Global Airway Health Day. My name is Janice Eadie. I've been a registered dental hygienist here in Toronto, Canada for about 14 years now. I've worked in both pediatric dental offices as well as general family practices. I've seen thousands of clients over the years, and as a dental professional, we often spend the most time in your mouth. So we especially know how important it is to be properly breathing through our nose, have correct tongue and oral posture. So this is crucial for facial and jaw development as well as maintaining the airways. So I'd like to speak to you today from a dental point of view, how important maintaining proper airway health is. So everyone knows that we can breathe through our nose and also our mouth. Most people don't realize breathing through our mouth has negative consequences on not only our facial beauty, our health, and our general well-being. So how we breathe, the quality of air we breathe, if we were breastfed or not, when hard foods are introduced into our diet, what's our oral posture like? Do we have allergies? Do we suck our thumb? Use a pacifier? All those sorts of things play a big role in facial and jaw development. And if those things do not develop properly when we're a kid, it's going to lead to a lot of health problems as the child ages. Mouth breathing triggers the fight or flight response in our body, which is great if we're trying to run away from a bear in the woods, not great when we're trying to sleep and repair and rebuild our body. We don't want to be stimulating stress, especially when we're sleeping. This is really critical for kids as they're growing, developing, human growth hormones being secreted in the night. All of these things get thrown out of whack when we're mouth breathing. Mouth breathing leads to a rapid depletion of energy in our body, and it triggers the stress hormones to be released. Nitric oxide is a very important molecule that has the ability to heal almost everything within our body, but it's only produced in our sinuses when we're breathing through our nose. It's not really produced when we're mouth breathing. So just like when we're young and our parents tell us to sit up straight, put our shoulders down and back, have good posture, we're also supposed to have good oral posture. So I'll go over it with you. So proper oral posture is basically just the position of your tongue and lips when we're at rest. So when we're not speaking or eating, our mouth should be at rest in this position, which I'll go over. So lips together, tongue to the roof of our mouth, and teeth should be slightly touching or very slightly apart in the back. Everyone's mouth is a little bit different, so I'm a little lenient on that. It's very important that the tip of your tongue is not resting on the back of your teeth at all. Our tongue is made up out of 8 muscles that are extremely strong, and they have the ability to shift teeth quite easily. So here's a little trick I tell children at work to get their tongue into the right position. So I tell them to make the noise, and right before your tongue makes that noise, that's approximately where I want your tongue to be. So if you feel behind your upper front teeth with your tongue, you should feel the rugae, which are those little bumpy ridges, and your tongue needs to be resting a little bit behind there. So the tip of your tongue should be right behind those bumpy ridges. And when you make this noise, that's approximately where it is. So a lot of people don't realize how soft and malleable our palate is, and especially when we're young, it can really change shape quite easily. So you really want to have good suction on the roof of your mouth. Because our tongue is so strong, it's the best palatal expander. We want to have a wide palate so our teeth come in straight. If we don't have our tongue to the roof of our mouth, basically our cheeks would cave in. Next up, I'm going to go over some facial features you would typically see in someone that's chronically mouth breathing and has poor oral posture. So not only do these features not necessarily look the nicest, more importantly, they're not as healthy for our body. So let's go over it. Once I show you this, I guarantee maybe even in your own self or somebody that you know, you're going to be able to identify them as a mouth breather. People that mouth breathe often have a longer face, dropped eyes, dark hollow circles under the eyes, open lips, sagging dry lips, flared nostrils, which usually indicates a difficulty breathing, weak cheek muscles, high palate, a narrow upper arch of teeth, which results in malocclusion, very crowded teeth, not enough room for teeth to come in. You might have an open bite if you're resting your tongue on the back of your teeth. You might have issues speaking, thin upper lip, and a lower lip will be poutier. Not only do mouth breathing and poor oral posture cause changes in your facial growth, they also impact the child's long-term health because the jaws, palate, and airway develop abnormally. This can lead to future TMJ issues, current or future obstructive sleep apnea, chronic illness due to fragmented sleep and body's inability to properly rest and restore, headaches, shoulder and neck pain, and poor posture. So a lot of people don't realize too that our upper jaw helps to give support to our eyes. So often people that don't have a properly shaped palate, your eyes will be a little bit more sunken. There's many reasons why someone might be breathing through their mouth. It can even happen to little babies a few hours after they're born. They might be allergic to something in the hospital. So allergies are a big one. That could be to animals, food, dust, tons of things. The indoor air quality in your house might be bad. They just might have poor oral posture, like I just went over. It's just a habit that you have to train yourself to get out of. They could have certain tongue habits. So a myofunctional therapist can help with that. Your child could have a tongue tie. It could be moderate or severe. So that's often checked at the hospital, but it can be something that's checked out when they're a little older at the dental office as well. Frequent viral infections, enlarged tonsils and adenoids. So sometimes children that are mouth breathing, they might need those out a little bit sooner. Extended pacifier use can really misshape the palate. Thumb sucking, same thing. It can flare the teeth out, misshape the palate. So what can you do, especially if you think your child is mouth breathing? So I would definitely videotape them. It's really important you have that documentation to show your doctor. Show them how concerned you are. If they're gasping for air, make note of all this. Often when the doctor does see that, they might refer the child for a sleep study. It's often not done in children, so you really kind of might have to push for it. But if you have videotape evidence, you should be able to get that done. Sometimes it's just as simple as the child might need their tonsils or adenoids out a little bit earlier. Something you can do on yourself, or I would not do this on very young children, but you could do mouth taping. So it sounds scarier than it is. They make mouth tape strips, or you can just get a 3M brand of the medical tape at the drugstore. You place a small piece of tape here before you go to sleep. And that just encourages you to get into the habit of keeping your lips closed while you're sleeping. And if you wake up and the tape is still there, then that's a good indicator that you can breathe through your nose. If you try this for maybe a week and you wake up and the tape is never there, that could indicate that you can't breathe through your nose. So it's maybe time to see your doctor. You might have to see a specialist. Sometimes mouth taping is all an adult needs, just to kind of force themselves to get into the habit. If we're not breathing through our nose, what happens is the nostrils, the airway passage starts to atrophy because we're not using it. You don't use it, you lose it. So it just encourages you to breathe through your nose, how we're supposed to. You might wake up feeling a lot more rested. Keep your bedroom very clean, dust-free. Get an air purifier. Air Doctor is really good. If you're in a bad habit, set reminders during the day and just to check your oral posture. Maybe eliminate perfumes, scented things, eliminate carpets, rugs, pet hair. Definitely don't let pets sleep in your bed or your children's bed. Change your pillows and bedding frequently. Keep windows and doors open to get fresh airflow. Use non-toxic cleaning supplies. Use the vents above your stove when you're cooking. Change the air conditioning filter. All these sorts of things just to really keep the home very clean. They often say that air in our home might be poorer quality than outside. You can have plants in the home that helps with the fresh air. People that always mouth breathe, often they get cavities a lot more frequently, a lot easier than people that are breathing normally, because our mouth is getting dried out. So your saliva is supposed to act as a buffer against that bad cavity-causing bacteria. When you're mouth breathing, that doesn't happen. It throws off the pH in your mouth. The bacteria get out of whack. It's very frustrating because some clients will have very good oral hygiene, yet they're continuously getting cavities, and often it's due to dry mouth. So it's important to keep our mouth closed too, just from a health perspective, as we don't want to get sick. You're more prone to airborne viruses. So with what's going on in the world right now with COVID, keep that in mind. It's a better practice to keep our mouth closed. Also, too, pollution in the air is not great to be breathing in. We want it to go through our nose so it gets filtered before it gets to our lungs. So if you're living in California right now, unfortunately, the forest fires, the air quality is poor. You just live in a more polluted city. Keep that in mind. So if you're concerned with your tongue placement, your teeth alignment, your breathing, who can help you? So first off, your medical doctor or your dentist, your dental hygienist, a myofunctional therapist, which is like a personal trainer for your mouth, speech pathologist for children can really help, functional dentist, lactation consultant if you're having a hard time breastfeeding, an ENT, possibly a plastic surgeon. So just in closing, our health and our overall appearance, it has a lot more to do with habit and environmental factors than you might think. It's not all genetics, so keep that in mind. And also remember, nose is for breathing and your mouth is for speaking and eating. Thank you so much for listening to me today. I hope maybe I taught you one or two things, a couple questions maybe you can ask for your doctor or dentist to check out the next time that you see them, just to ensure that your airways and your teeth, your mouth, everything is healthy. I appreciate you so much for watching. Bye.